Acute myeloid leukemia is one of the primary two types of leukemia we see in children. We see acute lymphoblastic and acute myeloid. Acute lymphoblastic is more common. Traditionally, acute myeloid leukemia, the outcomes have not been as good and has been more difficult to treat. My research is looking at chromosome number in cancer. So a really interesting observation in cancer is that most cancers actually have an abnormal number of chromosomes, so either too much DNA or too little DNA. And this is probably about 70% of hematologic malignancies and probably about 80%, 90% of solid tumors, again, have either too many chromosomes or too few. And I'm interested in kind of two questions. The first being, what's the effect of those extra chromosomes or too few chromosomes? How does that sort of affect the cancer cell, and how does that affect our ability to treat cancer? And then the second question related to that I'm really interested in is, can you some way target cells based on their DNA content? So the nice thing about aneuploidy, or again, either having too few or too many chromosomes, is that it would be a great potential therapeutic target because it very clearly differentiates cancer cells from normal cells. So the question I want to ask is, can you in some way target a cancer cell that has too many chromosomes or too few chromosomes? And I think you can think broadly, kind of two general ways you could do that. One is you could just try to target cancer cells that have an abnormal number of chromosomes, regardless of what specific chromosome they've gained or lost. And that would be sort of a more general approach. You can also imagine taking a more specific approach where you try to target a cancer cell based on exactly which chromosome it has gained or lost. For example, if a cancer cell has gained a copy of chromosome 8, are there specific targets or specific drugs that those cancer cells with the extra copy of chromosome 8 might be sensitive to? So I think the kind of the two big things I'm interested in is, one is sort of what are the biological effects of having too many or too few chromosomes, and then secondly, are there ways you can sort of target those cells with an abnormal number of chromosomes as a therapeutic target? What we've done is, the first part to really try to get at the basic biology and understand the pathophysiology of, again, too few or too many chromosomes, is we've developed ways where we've made cells that are essentially identical except for the presence or absence of an extra chromosome. We've done it in two different ways, and one of the ways we've done is there are some people who are actually born with two different types of cells. Some of their cells have the normal number of chromosomes, and some of their cells actually have an extra chromosome. And this is called mosaic aneuploidy. And the idea here is that if there was some way to take those cells and separate out the normal cells from the cells with the extra chromosome, since they're from the same individual, they're otherwise genetically identical. And that'd be then a really nice way to compare and try to ask very specifically, is what is that extra chromosome doing? And so that's exactly what we did. We obtained cells from an individual with mosaic trisomy 8. We're interested in trisomy 8 because it's very common in acute myeloid leukemia. And we took those cells and we actually turned them into pluripotent stem cells. And this is, I think, really important because then it allows us, once it's a stem cell, there's two really important properties. One is that those cells sort of will survive forever in culture, so we can do a lot with them. And secondly, we can actually differentiate them to sort of any cell type that we want. And in particular, our case, we're interested in differentiating them to hematopoietic cells because I'm interested in leukemia. So what we did is we took mosaic fibroblasts from a patient with mosaic trisomy, turned them into stem cells. And when we did that, we essentially got two populations. One population that had an extra copy of chromosome 8, and the other population which had the normal number of chromosomes. But again, since they were from the same individual, they were genetically identical otherwise. Now what we've been doing is we've been actually taking those stem cells and turning them into hematopoietic cells, and then asking what are the differences between the cells with the trisomy 8 versus the sort of normal number of chromosome 8. So to describe how I could potentially implement the results of this research into the clinic is, again, as I talked about before, is I think a really interesting outcome of this would be the ability to target cells with too few or too many chromosomes, because then it really clearly distinguishes sort of normal tissue from cancer tissue. And I think you could sort of think about it in this sort of the general sense, so you could just target any cell that has an abnormal number of chromosomes. And then the sort of appealing part of that is there'd be very, very broad applicability. So I think we could take a more personalized approach where, as part of pediatric oncology, we really collect karyotype or the chromosomal makeup of tumors as part of our workup and diagnosis. And so I think you can imagine where if we saw that there's an extra copy of chromosome 8 or loss of chromosome 7, that we might be then able to sort of prescribe specific drugs that would be would work particularly well with that karyotype, and this would be kind of a karyotype specific therapy. Again, there's also sort of the more broad applicability of just targeting aneuploid cells in general, and I think this would have applicability across many different tumor types in both pediatrics and adult medicine. So, I think there are sort of two different approaches. I think they're complementary. I think each has sort of advantages and disadvantages, but I think there are probably multiple ways that we could try to target the chromosomal makeup of tumor cells that really distinguishes it from normal cells. And I think for that reason, it makes it a really appealing target in cancer therapy.